Question here. Arterial fibrillation and verapamil 5 milligram IV bolus are prescribed. Which showed the nurse assessment? Answer is heart rhythm and blood pressure. A patient with a coronary artery disease and getting beta blocker nadolol. And what are the mechanism of action of beta blocker over the heart, or how evaluate the effectiveness? Beta blocker decrease the heart rate, decrease blood pressure, and relieve the chest pain. Next question. A nurse is carrying on simvastatin to lower the cholesterol level. How low does it work? Statin reduce in blood level, usually seen after 2 to 3 weeks. So cholesterol go down after 2 to 3 weeks. So 2 to 3 weeks take time to start the simvastatin to work. The patient with elevated LDL bile acid sequencing need further instruction. So what need further instruction? I should take this medication with food, with absorbed food. Next question here. Levastatin patient with elevated cholesterol level, and check for what levels. We should check for the liver function test, ALT. Question number 7. Non-steroidal anti-inflammatory drugs would potentiate, and what we could check for what? Temperature of 38 Celsius. So it means if patient has a fever, it should reduce the fever. Antipyretics, and also we use for severe or mild pain. Elderly patient taking aspirin every day inform the nurse. What assessment should the nurse do as a priorities? Answer is tinnitus and hearing loss. Aspirin can cause tinnitus and hearing loss in case of old adult person. Next question here. Acute episode of gout taking ibuprofen to control the pain. Patient report that he has had terry-colored stool. It indicates the bleeding. Discontinue the medication and notify healthcare provider. So if a patient take the pain medication and if any internal bleeding occur from gastrointestinal system, patient may be present with complain about the terry-colored stool, means stool mixed with blood. So if patient have complained about this, we tell them to discontinue the medication and notify healthcare provider. Question 11. Allopurinol therapy for the gout. It is anti-gout therapy we use to stop the gout. So what you could tell your patient about the allopurinol, teach about decrease the production of uric acid. So allopurinol decrease the action of uric acid. Question 12. During the night shift, healthcare provider report to the day shift nurse, which receives the report of the 4 patient. Which patient should she's supposed to go first? So there are 4 patients. Which patient we have to go? So means the patient who is really bad, we have to go first to check. A patient with an acute attack of gout who is taking colchicine every 2 hours for the pain. Allopurinol for management of the gout, uric acid level 10.5 milligram per day. So in that scenario, we still administer the drugs as ordered. Question number 14, the nurse emphasized the need to close monitoring the patient taking anti-TB for alcoholism. So it is good to educate patient anti-TB and alcohol is not together. It is better to stop. Next, question 15. Persistent asthma with mild is prescribed, and also patient, the two different drugs are prescribed. The patient asks, what are they for? So the severity is used to decrease the bronchospasm, and flavonoids helps to control the inflammation. A patient took the two medication for asthma. One is steroid, other is the Ceravent. So they said one used to decrease bronchospasm or constriction, other used for reduce the inflammation. Question 16. Caring for a patient who is prescribed a decongestant. He has a cardiac problem and alpha stimulant effect that may cause hypertension. Let me redo it. Caring for a patient who is prescribed decongestant. He has a cardiac problem. So alpha stimulant effect, this is the decongestant, may increase the hypertension. So we need to use with precursor when a decongestant applied for cardiac patient. Question 17, a nurse is reviewing the medication for a patient with a cardiac problem like congestive heart failure. Patient take decongestant, and what should the nurse assessment for? Basically, decongestant is an alpha stimulating effect, and they increase the blood pressure. So we have to check the patient blood pressure and hypertension. Question 18, the nurse is caring for a patient who has been prescribed alendronate. It is the medication for osteoporosis by the healthcare provider. What should the patient do? Patient should sit up for 30 minutes after take this medication. So tell them not to lie down at least 30 minutes. Sit up for 30 minutes after taking this medication. So